We start with LA County's new COVID vaccine mandate for some indoor spaces. Joining us is Dr. Howard Hu, chairs the Department of Population and Public Health Sciences at the USC Keck School of Medicine. He and his team at USC, by the way, have been working on COVID surveillance in partnership with LA County this year. Doctor, thanks for being with us. So we're trying to figure out if this makes sense. So if you can explain perhaps why one would need to have proof of vaccination going into a bar or a lounge or a winery, but not a restaurant or a gym.
That's a great question. I mean, let's take vaccination first. I mean, there's no question based on now many months of terrific scientific data that the vaccine works and it's safe for the vast majority of people. And it also is very clear that the epidemic is wreaking havoc, but almost entirely confined to the folks who are not vaccinated. This makes public health sense. Why it might be implemented in one set of venues but not another, I think that gets to the implementation part. There's always practical considerations on how well it can be enforced in one venue or another, or how well it will be received. And that's something that, I think that the public health authorities have to take into account as well.
It seems like, with this opposition in some quarters against vaccine mandates, and they always point to, the scientists don't know everything. And look, they keep changing their minds. And so you have these new mandates coming out. And there might be practical considerations to why you've got to have the vaccine proof here, but not so much here, even though it feels like the same kind of thing. Would it be better to err on the side of caution and just go all in or all out on the vaccine mandates for all these areas?
On some level, I think from a population health level, from my scientific level, I think that does make sense. And I do understand, that there are subgroups of the population that are cautious or even against it for a whole number of different reasons. But I think the science is pretty clear. I think another factor that, has to be taken into account is what we're beginning to call the epidemiology of disinformation, which is that there's whole segments of the population that just are skeptical or decline vaccination because they're seeing all sorts of bad information on the internet or elsewhere that says that the vaccine's unsafe or that it does something, untoward. And that's disinformation. We have to stand by that and stick with the science. And I think vaccinations make sense for everybody, depending on how we can roll it out and make it effective for all segments of the population.
I was wondering when I first saw the order a little while ago, specifying bars, wineries, that sort of thing, but leaving out, restaurants. It occurred to me, and I wonder what your thoughts are on this, that, as you know, the vaccination rate among younger people in their 20s is lagging behind older people. Younger people, not exclusively, but they do tend to frequent bars and lounges, more than older folks who tend to go more to restaurants. So I'm wondering if this is aimed partly at trying to give a much-needed incentive for younger people to get vaccinated if they want to go to their bars again.
I think that's a great guess. And it would be really interesting to see whether the Department of Health, Public Health, would find that as a as a reasonable guess as to why the policy was implemented in this way. And so, of course, I'm sure there's sensitivities all around in clarifying exactly why they chose to roll out the policy this way. But I think that's as reasonable a guess as any.
All right. Thank you so much. Dr. Howard Hu, chairing the Department of Population and Public Health Sciences at the USC Keck School of Medicine.
I'm not a betting guy, but if I had a bet, that's where my bet is.
Yeah.